Hi everyone, this is Trisha Erpelding, the Director of Education and Advocacy at Mental Health America, and I wanted to take just a few moments today to talk to you about anxiety. We know that anxiety disorders are the most common form of mental illness in the United States, and about 20% of adults and 30% of adolescents and teens struggle with some form of anxiety. We also know that the average age of the first symptoms of anxiety show up around 11 years old. So when youth start to experience these things, oftentimes they may not know how to reach out for help or really how to put into words, some of the signs and symptoms that they're experiencing. So hopefully today I'll be able to shed a little bit of light on that and provide a couple of options for finding support and reaching out and getting the help that you might need for yourself or someone that you care about. So when it comes to anxiety, this is really kind of an overarching mental illness that has a couple of other mental illnesses within it. So there's, generalized anxiety disorder, which is kind of that, general persistent fear or unease, uncomfortability with everyday situations. There may be, certain things that cause a little bit more anxiety than others, but it's, again, just kind of that general, feeling of being uncomfortable, being fearful, being worried. There are things like panic disorder or different phobias that people experience. And these cause, kind of that sudden onset. Perhaps there's a certain trigger that causes them, and people are feeling those symptoms of, not being able to breathe, excessive sweating, the fear. And it's not just, for example, someone being scared of, a spider or a snake if they're out on a hike, and kind of having that like, oh gosh, that freaked me out. It's, a debilitating, really difficult situation to get through. There are people who oftentimes will experience nausea, not being able to catch their breath. Sometimes people even pass out from their anxiety and that kind of sudden onset during their panic attack or being triggered within their phobia. There are also folks who struggle with obsessive compulsive disorder or OCD, and that is a combination of intrusive, anxious thoughts and also then the kind of compulsion to show certain behaviors in order to kind of help control some of those thoughts. And then we have anxiety disorders such as PTSD, post-traumatic stress disorder, which can occur in individuals who have experienced some sort of trauma that then leads them to have those anxious thoughts and anxious feelings. And it's very common for people during stressful situations to have a little bit of kind of mild anxious thoughts. Whenever we are, dealing with stress or having challenges to meet, it does, kind of change the way that we're feeling a little bit. We might feel more stressed. We might feel a little more uncomfortable. But for someone who is not struggling with anxiety disorder, they're able to kind of get through that. They're able to, kind of help themselves manage their stress in different ways and able to kind of get through that challenge and move on. Someone who has anxiety disorder really sees that disruption to their daily life. So they may have trouble sleeping. They may have trouble eating, eating too much or eating too little. They may struggle with having trouble concentrating. For a lot of folks with anxiety, often those anxious thoughts and those anxious feelings really take over a lot of what they're feeling and what they're thinking about. So it can be really difficult for somebody to concentrate on work or concentrate on school when they're struggling with anxiety. But we also know that there are a lot of different treatment options available for individuals who struggle with anxiety. We have a number of therapists who practice within our area who specialize in treating anxiety. For a lot of youth out there, if you go to one of the public schools in Sheboygan County, you can talk to a teacher or a counselor about maybe enrolling in the PATH program, providing access to healing, which offers therapists right within your school building. And that is, one option that you can take. I encourage everyone, though, if you feel like your anxiety has kind of crossed that level, like it's not just stress, it's something that is really starting to have an impact on your daily life, really starting to interrupt how you normally go about your day, your social interactions, talking with your friends and your family. It's, having an impact on work or school. Make sure that you're reaching out to somebody who can help you. And like I said, that could be a teacher, that could be a parent, that could be a counselor, a coach, some adult in your life that can help you and connect you with the people who can help. Mental Health America is also available to provide resources to individuals. We have a really great website, mhasheboygan.org, that has a number of different resources and ways for you to get support. We have an online therapist database where you can go on and just type in anxiety, and it'll show every therapist in our community who specializes in treating anxiety. This also goes for, all other mental health conditions as well. If you're perhaps struggling with depression or bipolar disorder, you're able to use those different search words and find a therapist who might be a good fit for you. And you're always, always welcome to give us a call. Our phone number is 458-3951, and we are available to answer your call, answer your questions about mental illness, mental health, how to stay mentally well, and we're here to just provide that support to you. So if you are worried about yourself or somebody else, I encourage you to reach out, find the help that you need in order to be as mentally healthy as possible. Thank you all for watching, and I hope you have a great rest of your day.